And then as we move up from the broad ligament, the highest or the higher pedicles of the uterus that we have to divide are the round ligaments, and then the uteroovarian. Now this is describing what you would do for just a simple, straightforward hysterectomy without salpingo-oophorectomy. If you are going to remove the ovaries at the same time, you might choose to divide the uteroovarian ligament and vessel first, and then move out to the infundibulopelvic ligament containing the ovarian vessels, which would allow you to ligate and remove the ovaries. In an abdominal case, you're more likely to just ligate the IP first and not separately ligate the uteroovarian, whereas in the vaginal you would do this first usually. But these are two important pedicles you need to remember. This one does contain quite a bit of vasculature, and we often will double ligate that pedicle to ensure that we don't have residual bleeding. So regardless of the order that you've done these things, these are the steps that are common to all hysterectomies. If you're performing a salpingectomy, you might choose to take the tubes separately. You can choose to take them in the same pedicle and take it en bloc with the uterus. It just depends on what else you're doing and the route you've chosen. All right, well, this was a quick overview of hysterectomy. It obviously is not the pictorial step-by-step guide. References that you could choose to look in would be any of the gynecologic textbooks. Some Tillen's Operative Gynecology is one that we commonly use. Atlases of pelvic surgery will often have descriptions of these procedures as well. But the important thing, I think, if you're a student who is coming onto the gynecology service, is to pre-op review your anatomy, and this would include the vasculature, nerves, major organs in the vicinity. And then review the patient's history and the indications for why the surgery is being done. These are the things that your residents and faculty are going to be looking for as you are asked questions about the surgery that's being done. We don't expect that you know how to do these surgeries, obviously, but we want to know that you put some thought into studying the relevant anatomy and why certain structures are important in doing the case, why we look for things like the ureter as we're doing the case, and that you really have a firm grasp of the disease process that we're trying to correct as part of the indication for the surgery. Because without knowing that, then it's really impossible to talk about the chance of cure and to truly weigh the risks and the benefits of your disease versus the risks of the procedure. Anyway, this has been a review and introduction to hysterectomy.